Welcome to Dr. Catherine Collins, where science meets smart health decisions. Let's start with something every man has, but many still don't fully understand: the prostate. So, what exactly is the prostate? The prostate is a small, walnut-sized gland. It's part of the male reproductive system, and it's located just below the bladder and in front of the rectum. It's wrapped around a tube called the urethra, and that's important. We'll come back to that. The main job of the prostate: it produces a special fluid that mixes with sperm to create semen. This fluid protects the sperm and helps them move better. Without it, male fertility would be impossible. Now, this gland is tiny when you're young, just about 20 grams. But as you age, something interesting and sometimes problematic begins to happen. It starts to grow. HOWT, the prostate, functions. Let's take a closer look. The prostate works in harmony with your testicles, seminal vesicles, and penis to support your reproductive health. It produces prostatic fluid, which contains enzymes, proteins, and minerals that nourish sperm. One key enzyme is prostate-specific antigen, or PSA. It helps keep the semen in a liquid state, so sperm can move freely. You hear a lot about PSA in medical checkups, especially in prostate screening tests, but more on that later. Another important thing to understand is that the muscles in the prostate also help push semen out during ejaculation. It's an active gland, and one that's deeply connected to both sexual health and urinary function. HIRE, common changes with age. Now here's where things get interesting and often frustrating for older men. As men hit their 40s and beyond, the prostate starts to enlarge. This condition is called Benign Prostatic Hyperplasia, or BPH. This growth isn't cancerous, but it can cause real problems. Think of it like this. Your urethra, the tube that carries urine from your bladder, runs right through the prostate. So, as the prostate grows, it begins to squeeze the urethra, like stepping on a garden hose. The result? Difficulty starting to pee, a weak stream, the constant feeling of needing to go, even at night, a bladder that never seems fully empty. These are common signs of BPH, and they can really affect your quality of life. HOWT, prostate versus urinary system. What's the connection? A lot of men get confused between prostate problems and bladder issues. Here's the key. Your bladder holds the urine. Your urethra carries it out. Your prostate surrounds the urethra. So if the prostate swells or becomes inflamed, it presses on the urethra, making it harder for urine to pass. This is why urinary symptoms are often the first sign something's going on with your prostate, not necessarily pain or discomfort at first. Think of your urinary system like plumbing. If the pipe gets pinched or clogged, pressure builds up. Over time, your bladder has to work harder, and eventually it can become overactive, irritated, or even weak. That's why prostate health is urinary health. Why you need to pay attention now. The earlier you understand how your prostate works, the better prepared you are to recognize problems before they become serious. If you wake up more than twice a night to pee, have trouble starting or stopping your flow, feel burning, discomfort, or pressure, notice changes in sexual function, it's time to have a conversation with your doctor and with yourself. This isn't about fear. It's about awareness. The prostate may be small, but it plays a big role in how you feel, function, and enjoy your life, especially as you age. Now that we understand what the prostate is and how it functions, it's time to talk about something even more important: the warning signs. You see, your body is smarter than you think. It gives you clues, sometimes whispers, before it ever screams, and the prostate is no exception. So let's walk through the most common early symptoms and what they might mean. Alarm. Number 1. Frequent urination, especially at night. Do you find yourself waking up 2, 3, even 4 times a night to pee? That's not just aging. That's your prostate talking. When the prostate grows, it presses on your urethra and bladder. The bladder becomes more sensitive, signaling you to urinate even when it's not full. This can lead to interrupted sleep, fatigue, and, over time, serious kidney strain. Don't ignore this one. Toilet. Number 2. Difficulty starting or stopping urination. You go to the bathroom. You're ready to go, but nothing happens right away, or it dribbles, or you feel like it just doesn't want to stop. That's classic BPH, benign prostatic hyperplasia. The prostate is pressing the urethra like a clamp, and it's making it harder for urine to flow freely. You might think it's just age, but it's a signal. Water drops. Number 3. Weak or interrupted urine stream. Let's be blunt. You used to have a strong stream. Now, not so much. That's because the path urine takes is being squeezed, and your bladder has to push harder to overcome the resistance. Over time, the bladder becomes overworked and may even become damaged. This isn't just a comfort issue. This is your body telling you the system is under pressure. Alarm. Number 4. Feeling like you can't completely empty your bladder. You go, but 5 minutes later, you feel like you have to go again. That's because you're not emptying completely, and this can cause bacteria to build up, increasing your risk of bladder infections, stones, and even kidney problems. Incomplete emptying is one of the most underreported and dangerous signs. Fire. Number 5. Pain or burning during urination. This isn't just an aging prostate, this might be a case of prostatitis, which is inflammation of the prostate. It could be due to infection, injury, or chronic inflammation, and it needs medical attention. Pain is not normal. It is never something to tough out. Pain means your body is fighting something. Heart. Number 6. Erectile dysfunction or changes in sexual performance. The prostate is a key part of the male reproductive system. If something's wrong, inflammation, enlargement, or cancer, it can impact libido, erections, and ejaculation. You may notice reduced semen volume or discomfort during ejaculation. And while ED has many causes, prostate health is often involved, especially in older men. Blood. Number 7. Blood in urine or semen. Even a tiny drop is a major red flag. This could indicate prostatitis, BPH, urinary tract infections, or in rare cases, prostate cancer. This is not something to wait and watch. If you ever see blood in your urine or semen, call your doctor immediately. Timer. Number 8. Sudden urinary retention. You can't pee at all. This is a medical emergency. If the prostate grows large enough, it can block the urethra completely, and you suddenly can't urinate at all. It's painful, it's dangerous, and it requires immediate catheterization or surgery. The good news? You can avoid this outcome by recognizing the earlier signs we've talked about. Brain. Don't wait, don't dismiss. Here's what we see as urologists. Men often delay help. They feel embarrassed, they think it's just getting older. But this delay can turn a treatable issue into a life-altering one. The earlier you act, the more options you have, often without surgery. Pencil. What to do if you notice these signs. Track your symptoms. Get a PSA blood test. Schedule a digital rectal exam, RDE. Ask for a bladder ultrasound. Review your diet and habits. More on that soon. Knowledge is power, but action is everything. What causes prostate inflammation? Now that we've covered the warning signs of prostate problems, it's time to dig deeper. Let's ask the question, what's actually causing your prostate to become inflamed, enlarged, or irritated? You see, an inflamed prostate, known medically as prostatitis, isn't always about infection. There are multiple triggers, and if you want real relief, you need to know the root cause. Let's break this down, one by one. 1. Bacterial infection, when germs get in. Yes, prostatitis can be caused by bacteria, just like a bladder infection or a cold. These bacteria usually come from the urinary tract, or sometimes from the bloodstream. Common culprits include E. coli, Klebsiella, Proteus, Pseudomonas. These are bacteria that live naturally in your gut, but can cause havoc when they get into the prostate. How do they get in? Unprotected sex, poor hygiene, holding urine too long, catheter use or surgery. Symptoms may include burning urination, fever and chills, pain in the lower back or groin, painful ejaculation, cloudy or bloody urine. This is called acute bacterial prostatitis and needs immediate antibiotic treatment. But that's just one type of prostatitis. 2. Non-bacterial causes, the silent majority. Here's the surprise. Most cases of chronic prostatitis aren't bacterial. In fact, doctors call it chronic pelvic pain syndrome because inflammation exists, but no bacteria are found. What causes it? Several things may contribute. Pelvic muscle tension, autoimmune reactions, nerve sensitivity, stress, and anxiety. That's right. Your brain, your muscles, and your immune system could all play a role. For example, if your pelvic floor is tight or constantly tense from sitting too long, bad posture, or chronic stress, it can irritate nerves that wrap around the prostate. This leads to burning, aching, and urinary symptoms, but antibiotics won't help. This is why so many men are misdiagnosed or sent home with the wrong treatment. 3. Lifestyle and dietary triggers. You could be feeding the fire. Now let's talk about everyday habits, what you eat, how you move, and what you do. Certain foods and drinks can irritate the prostate and make inflammation worse. These include spicy foods, caffeine, alcohol, processed meat, fried foods, high-sugar snacks, dairy for some men. These items increase systemic inflammation, not just in your gut or blood vessels, but also in your prostate tissue. Lack of hydration? That thickens your urine, irritates the urinary tract, and can backfire into prostate pain. Sitting too long? That puts pressure on your pelvic floor and prostate for hours, leading to chronic inflammation over time. Lack of exercise? That slows down circulation, weakens the immune response, and increases abdominal fat, which promotes hormonal imbalance. Every choice matters. Day by day, your habits either cool the fire or feed it. 4. Environmental toxins, the hidden enemy. This is something most men never think about. You're exposed to endocrine disruptors every single day in plastics, pesticides, cleaning products, and even grooming products. These include chemicals like phthalates, BPA, bisphenol A, dioxins, heavy metals like lead or cadmium. These toxins mimic hormones or interfere with your natural hormone balance, contributing to inflammation, estrogen dominance, oxidative stress, and lower testosterone. Your prostate is highly sensitive to hormonal changes, which we'll discuss next, and when your detox system is overwhelmed, inflammation increases silently. Ways to reduce exposure. Drink from glass, not plastic, avoid processed and pesticide-laden foods, use natural or unscented personal care products, purify your water and air when possible. It may not be immediate, but long-term exposure is like a slow drip of poison into your prostate health. 5. Hormonal imbalances, the overlooked factor. Now, here's the critical piece of the puzzle. Your prostate is hormonally driven. Its growth and function depend on hormones like testosterone, dihydrotestosterone, DHT, estrogen, and cortisol. As you age, your testosterone may decline, while DHT, a more potent version, stays elevated. Too much DHT causes prostate cells to grow, leading to BPH, Benign Prostatic Hyperplasia. On the flip side, rising estrogen levels, from fat cells, diet, or toxins, can fuel inflammation and increase prostate cancer risk. Chronic stress raises cortisol, which lowers testosterone, disrupts immune balance, and increases inflammation. And remember, the prostate is highly vascular, meaning it's sensitive to every hormonal shift. Balancing hormones through sleep, stress control, exercise, clean diet, and weight management can dramatically reduce inflammation. Conclusion: inflammation has many faces. Let's recap. Prostate inflammation can be triggered by infection, tension and nerve hypersensitivity, food and lifestyle, toxins, hormone disruption. And most of the time, it's not just one cause, but a combination of all of them. That's why treating it requires a multi-layered approach, not just a pill or surgery. In the next section, we'll show you exactly how to support your prostate naturally and effectively through diet, movement, supplements, and daily routines. The truth about BPH, benign prostatic hyperplasia. Let's talk about something that affects nearly every man as he ages, yet is often misunderstood or ignored until it's too late. It's called BPH, or benign prostatic hyperplasia, and it's the most common non-cancerous enlargement of the prostate gland. How common is BPH after age 50? If you're over 50, there's a good chance your prostate is already growing, even if you feel fine. Here are the numbers. By age 50, about 50% of men have some degree of BPH. By age 60, about 60%. By age 70, about 70%. By age 80, up to 90% of men show BPH symptoms or enlargement. This isn't cancer, it's benign. But don't let the word benign fool you. BPH can severely affect quality of life. Symptoms and diagnosis. What does BPH feel like? As your prostate grows, it starts pressing against the urethra, the thin tube that carries urine out of your body. This causes a chain of symptoms known as lower urinary tract symptoms, or LUTS. Slow or weak urine stream, trouble starting to urinate, dribbling after urination, feeling like your bladder doesn't empty fully, sudden urges to go, getting up 2 to 3 times or more at night to urinate. Many men normalize these symptoms. I just drink too much water. It's just aging. But these signs point to BPH, and they can worsen over time. Doctors diagnose BPH through symptom questionnaires, like the IPSS score, digital rectal exam to feel the prostate, PSA test to rule out cancer, ultrasound or uroflowmetry to assess urine flow and bladder health. Natural progression. What happens if you ignore it? BPH isn't deadly, but it can become debilitating. Over time, if left untreated, the bladder has to work harder, so the muscle thickens. Eventually, the bladder becomes overworked and weak. Urine backs up, increasing risk of UTIs and bladder stones. In severe cases, kidney damage due to blocked flow. And here's the kicker. Men with untreated BPH are more likely to suffer urinary retention, where you suddenly can't urinate at all, a painful emergency that often requires a catheter. This is why early detection and management matter. When to consider treatment, it's not just about drugs. So, when should you treat BPH? Ask yourself, are symptoms interfering with sleep, work, or quality of life? Are you avoiding travel or social events due to urgency or fear of accidents? Are you feeling frustrated, tired, or anxious about your urination? If the answer is yes, it's time to act. Treatment options include lifestyle adjustments, natural supplements, which we'll cover in the next part, prescription medications like alpha blockers or 5-alpha reductase inhibitors, minimally invasive procedures like Urolift or Rezum, surgery, TURP, or laser, only for severe, unmanageable cases. But here's the good news. Most men can manage BPH without surgery if they start early with the right knowledge, habits, and support. In summary, what you need to know about BPH. BPH is extremely common after age 50. It's not cancer, but it can severely impact daily life. Symptoms usually come on slowly, but worsen if ignored. Early lifestyle changes and non-drug interventions can make a big difference. Don't wait for a urinary crisis to take your prostate health seriously. In the next section, we'll show you natural, science-backed ways to reduce inflammation, shrink your prostate, and regain control of your bladder without surgery. Diet and lifestyle to reduce inflammation. So far, we've explored what the prostate is, what causes inflammation, and the realities of BPH. Now it's time to get practical. How can you take control of your prostate health starting today? It all begins with your daily habits, what you eat, how you move, and how you manage stress. Because inflammation is the root of most prostate problems, and lifestyle is your most powerful medicine. Let's dive in. 1. The anti-inflammatory diet plan. First, let's talk about food. Every bite you take either feeds inflammation or fights it. Your goal? To follow an anti-inflammatory diet that lowers oxidative stress, improves blood flow, supports hormone balance, and feeds your gut microbiome. Here's what that looks like. Foods to add: fruits and berries, rich in antioxidants and polyphenols. Leafy greens, spinach, kale, arugula, for vitamin K and fiber. Fatty fish, like salmon, mackerel, sardines, for omega-3s. Whole grains, brown rice, oats, barley. Legumes, beans, lentils, chickpeas. Healthy fats, olive oil, avocados, nuts. Herbs and spices, turmeric, ginger, garlic, parsley. Foods to avoid or reduce: processed meats, refined carbs, white bread, pastries, deep-fried foods, excessive red meat, sugary drinks, alcohol in excess. These foods trigger inflammation, gut imbalances, and hormone disruption. 2. Superfoods that support the prostate. Certain foods go above and beyond in protecting the prostate. Let's look at the top contenders. Tomatoes, rich in lycopene, an antioxidant linked to lower risk of prostate enlargement and cancer. Cooked tomatoes, like in sauce or soup, increase lycopene absorption. Green pumpkin seeds, packed with zinc, which support prostate function and testosterone levels. A handful a day can help reduce urinary symptoms. Green tea contains catechins, a group of polyphenols shown to reduce prostate inflammation and slow the growth of abnormal cells. Walnuts and Brazil nuts, full of omega-3s, selenium, and antioxidants. Pomegranate juice, rich in polyphenols that protect the prostate. Make these foods part of your daily routine. They don't just taste good, they fight disease at the cellular level. 3. Exercise and pelvic floor training. Movement isn't just good for your heart and waistline, it's essential for your prostate. Here's how. Regular exercise improves blood circulation, lowers inflammation, and boosts testosterone. Aim for 30 to 45 minutes of moderate activity 5 days a week. Brisk walking, swimming, cycling, or resistance training. But don't forget your pelvic floor. Pelvic floor muscles support the bladder and prostate, especially important if you have urinary symptoms. Try these Kegel exercises. While sitting or lying down, contract your pelvic muscles as if stopping urine midstream. Hold for 5 seconds, relax for 5 seconds. Repeat 10 to 15 times, 3 times a day. Over time, you'll notice improved control and fewer bathroom trips. 4. Reduce sugar, processed foods, and alcohol. Sugar is one of the biggest drivers of inflammation, and unfortunately, it's hidden in everything from cereal to salad dressing. Here's why you need to cut back. Sugar feeds bad bacteria in the gut. It spikes insulin and estrogen, which affect prostate size. It contributes to belly fat, a source of inflammatory cytokines. Also watch out for processed foods, packed with preservatives, sodium, and unhealthy oils. Excessive alcohol, which dehydrates, weakens the liver, and irritates the bladder. Limit alcohol to no more than 1 to 2 drinks a day, or consider going alcohol-free to let your body reset. 5. Mental health and stress management. Chronic stress is often overlooked, but it plays a huge role in prostate inflammation. Why? Stress increases cortisol, a hormone that worsens inflammation. It disrupts sleep, digestion, and testosterone. It leads to poor lifestyle choices, like overeating, drinking, or avoiding exercise. That's why managing stress is as important as managing diet. Try deep breathing. Inhale for 4, hold for 4, exhale for 6. Meditation or prayer. 10 minutes a day can change your brain. Nature time. Walking outdoors reduces cortisol and boosts mood. Social connection. Isolation is a silent killer in men over 50. If you're struggling, don't hesitate to seek support. A healthier mind means a healthier body and a healthier prostate. Final thoughts. You have more control than you think. Diet and lifestyle are the foundation of prostate health. You don't need to wait for a diagnosis to start healing. You can begin right now with what's on your plate and how you live each day.
Prostate cancer, risk, prevention, and early detection. In this chapter, we tackle a topic that causes fear and confusion for many men: prostate cancer. It's one of the most common cancers in men, but the good news is it's also one of the most treatable when caught early. Let's break it down in simple terms: what causes it, who's at risk, and how you can stay ahead. Genome. 1. Risk factors. What increases your chances? Prostate cancer doesn't develop overnight. It's the result of many factors coming together over time. Age. Risk rises sharply after age 50, and most cases occur in men over 65. Family history. If your father or brother had prostate cancer, your risk doubles. Race. African American men are more likely to develop it and at younger ages. Diet. High intake of red meat, dairy, processed food, and saturated fat has been linked to increased risk. Obesity. Being overweight may raise the risk of aggressive or advanced prostate cancer. Low physical activity. Sedentary lifestyles weaken the body's natural defenses. Inflammation and STIs. Chronic prostatitis or past infections may increase cancer risk through DNA damage. These are modifiable and non-modifiable risks. You can't change your age or genes, but you can influence many lifestyle and dietary factors. Old man. 2. Genetics and age, the uncontrollable risk factors. Let's focus on 2 critical risk factors. Age. Prostate cells become more vulnerable to genetic mutations as we get older. Most men over 70 will have some cancer cells in their prostate, though not all become dangerous. Genetics. Inherited mutations like BRCA1 or BRCA2, also linked to breast cancer, increase prostate cancer risk. If 2 or more close male relatives had it, you may be a candidate for early screening, even before age 50. It's important to know your family history and discuss it with your doctor. Test tube. 3. Testosterone. Fuel for growth or misunderstood? There's a common myth: testosterone causes prostate cancer. But here's what science actually shows. Testosterone doesn't cause prostate cancer, but it can stimulate the growth of existing cancer cells. Men with low testosterone can still develop prostate cancer. Extremely high levels from synthetic use or testosterone therapy might carry more risk, but more research is needed. If you're on testosterone replacement therapy, regular monitoring is essential. It's not about fear, it's about being informed and proactive. Increasing chart. 4. PSA testing. Helpful or harmful? PSA stands for prostate-specific antigen, a protein made by the prostate. Higher levels might mean prostate cancer, BPH, enlargement, prostatitis, inflammation, even recent ejaculation or vigorous exercise. So why the debate? Checkmark. Pros of PSA testing. It can detect cancer early, before symptoms start. A rising PSA level may catch aggressive cancer early enough to treat. Cross mark. Cons of PSA testing. It's not specific. False positives are common. It may lead to unnecessary biopsies or anxiety. Some slow-growing cancers may never become a threat, but still get treated aggressively. Conclusion. PSA is a tool, not a perfect test. It works best when combined with a digital rectal exam, MRI, and family history review. Calendar. 5. Screening guidelines. What you should know. Here's a simplified look at screening recommendations by most major health groups. Ages. 40 to 49. Only if you have strong risk factors: family history, African descent, genetic mutations. Ages. 50 to 69. Discuss PSA testing with your doctor. Screening is individualized, based on health, values, and life expectancy. Over 70. Screening is usually not recommended unless you're in excellent health and expected to live 10 plus years. Light bulb. The key: informed decision making. You and your doctor should weigh the benefits and risks together. Final message: early action saves lives. Prostate cancer doesn't always come with warning signs. That's why awareness, education, and smart screening are your best defense. Start by knowing your family history.
talking to your doctor if you're over 50 or over 40 with risk factors, maintaining a healthy diet and lifestyle, managing inflammation and stress.
Treatment options for prostatitis, BPH, and cancer. Now that we've explored the causes and early detection of prostate issues, it's time to talk about treatment, what really works, when to act, and how new technology is changing everything. Whether you're dealing with inflammation, enlargement, or even cancer, there are many safe, effective paths forward. Let's break them down one by one. Let's start with prostatitis, the inflammation of the prostate. There are two types: bacterial prostatitis, often treated with antibiotics like ciprofloxacin or doxycycline; non-bacterial prostatitis, chronic pelvic pain syndrome, harder to treat, may involve alpha blockers, muscle relaxants, and even antidepressants for nerve pain. For BPH, benign prostatic hyperplasia, the most common treatments include alpha blockers, like tamusolin, help relax muscles in the bladder and prostate; 5-alpha reductase inhibitors, like finasteride, shrink the prostate over time by blocking hormone conversion; combination therapy. Using both can be more effective, especially for larger prostates. For prostate cancer, treatment depends on severity. Active surveillance for slow-growing cancers, hormone therapy to reduce testosterone levels, radiation therapy or surgery for localized cancers, chemotherapy or immunotherapy for advanced cases. Your urologist will tailor the plan based on your PSA levels, Gleason score, MRI, and health status. Natural supplements for prostate health. Nature offers some powerful allies. Let's talk about scientifically supported supplements. Saw palmetto, extract from a small palm tree, helps relieve urinary symptoms in BPH by blocking DHT, a hormone that enlarges the prostate. Pygeum, bark of an African plum tree, reduces inflammation and improves urine flow. Beta-citrosterol, found in plants like avocados and nuts, may ease BPH symptoms and reduce cholesterol. Pumpkin seeds, rich in zinc and phytosterols, support bladder health and reduce inflammation. Stinging nettle root, often combined with saw palmetto, helps reduce nighttime urination. Green tea extract contains EGCG, a powerful antioxidant that supports prostate cell health. Always consult your doctor before starting supplements, especially if you're taking other medications. When to choose surgery. Knowing the signs. Surgery is usually not the first option, but in some cases it's the best way forward. For BPH, surgery may be considered when medications fail, urinary retention occurs, frequent infections develop, bladder stones or kidney damage appear. Common BPH procedures include TURP, transurethral resection of the prostate; HOLE, laser enucleation; Urolift or Rezum, less invasive options. For prostate cancer, surgery might involve radical prostatectomy, removing the entire prostate, done via open, laparoscopic, or robotic surgery, like the Da Vinci system. It's often recommended when cancer is contained within the prostate and the patient is healthy enough for recovery. Side effects and recovery. It's crucial to be realistic about recovery and side effects. Common short-term side effects after prostate surgery: pain or discomfort, fatigue, catheter use. Long-term effects may include erectile dysfunction, especially if nerves are affected; urinary incontinence, usually temporary but can last; reduced semen or dry orgasms. Recovery depends on age, health, and type of procedure. Pelvic floor therapy can greatly reduce urinary leakage, and medications like sildenafil, Viagra, can assist with erectile recovery. Prostate health, your daily commitment. You've just completed an in-depth journey through one of the most important and often overlooked parts of men's health, the prostate. Let's take a moment to summarize, reflect, and most importantly, act. Because knowledge is power, but action saves lives. Summary of key takeaways. Here's what you've learned across these 7 parts. What the prostate is and how it changes with age. The warning signs of prostatitis, BPH, and cancer. The underlying causes, from bacteria to hormones to your daily habits. Why early detection is critical, and how to do it. Natural strategies to lower inflammation and strengthen your prostate. The truth about PSA,
treatments, and surgery. Your prostate health checklist. Let's simplify it into a prostate protection plan you can start today. Get checked. Annual prostate exams after age 50 or earlier with family history. Monitor PSA. Track your numbers, don't ignore trends. Eat smart. Tomatoes, fatty fish, green tea, pumpkin seeds, berries, cruciferous veggies. Hydrate. Water is your prostate's best friend. Exercise. 30 minutes daily, including pelvic floor training. Manage stress. Use breathing, meditation, or journaling. Limit triggers. Cut back on red meat, alcohol, smoking, and processed foods. Watch your bathroom habits. Don't strain, don't hold it too long. Talk to your doctor. Be open, ask questions, and get second opinions. Know your family history. It could save your life. Daily habits for prevention. Here are 5 things you can do every day to reduce your risk. Eat 1 serving of prostate-supporting food like tomatoes or pumpkin seeds. Walk at least 20 to 30 minutes. Drink at least 2 liters of water. Reduce stress for 15 minutes. Try deep breathing or meditation. Prioritize sleep, 7 to 8 hours of quality rest. Warning, and final doctor. Gentlemen, listen closely. The most dangerous thing about prostate problems isn't the disease itself. It's ignoring the early signs, staying silent, or believing it's just part of aging. I just pee a little more often, it's no big deal. My dad had it, I'll deal with it when it happens. I'm too embarrassed to ask my doctor. Please don't wait. Every year, millions of men suffer silently when just a few changes and 1 checkup could have protected their quality of life or even saved it. Call to action. You're in control. If this video has helped you or someone you care about, do the following right now. Schedule a prostate checkup. Don't delay. Subscribe to Dr. Catherine Collins. We're here every week with real science, real health. Share this video with your brother, father, friend, or coworker. Start a lifestyle reset, 1 small change at a time. Comment below with your thoughts or questions. We're listening. You don't need to live in fear. You don't need to suffer in silence. You just need to take the first step. Because smart men take care of their brain. Wise men take care of their heart. But brave men, they take care of their prostate too. This is Dr. Catherine Collins, where medicine meets the future. We'll see you in the next video. Take care of your health, take charge of your life.